Welcome to Module 4, where we will review Appendix G of the Standards of Practice for Non-Sterile Compounding. Upon completion of this module, you will be able to evaluate a compounding practice environment, assess the complexity of compounds, determine the toxicity of compound ingredients and their associated risks, and also describe risk mitigation strategies to be used during compounding to protect both staff and the public. The compounding supervisor is responsible for evaluating the compounding practice environment in their pharmacy. The process for evaluating a compounding practice environment is outlined in Appendix G of the Standards of Practice, and also in a separate document on the NSCP website titled Considerations for the Evaluation of the Compounding Practice Environment. Before deciding to make a compound, we need to consider two things: complexity and safety. The compounding supervisor needs to ensure their pharmacy has adequate facilities to safely accommodate the complexity of the compounds they prepare. In terms of safety, they need to ensure they are implementing policies, procedures, and risk mitigation strategies that protect both employees and patients. It is important to note that the evaluation of a practice environment needs to be specific to each individual pharmacy. Every pharmacy is different. Different layouts, different staff, different prescriptions. No one, including the NSCP, can tell you which compounds you can prepare or what facilities or equipments you would require. The result of an evaluation for a specific compound may be very different at one pharmacy compared to another, and that is okay. There is no right or wrong way to evaluate a practice environment and no generic template to follow. We need to ensure we are meeting the needs of our patients and not limiting access to important medication. Unlike NAPRA, the Nova Scotia College of Pharmacists does not categorize compounds as simple or complex, and thus has no specific regulations or requirements based on this. Our standards allow pharmacy practitioners to use their professional judgment when evaluating the compounding environment. That being said, most compounds done in the community pharmacy setting would be considered simple. For example, 50-50 cream or ointment mixtures, magic mouthwash, or powder ingredients mixed in a cream or ointment base. We need to remember that the purpose of the compounding standards is not to stop us from compounding products we have been making for many years. It is to improve and standardize processes to ensure public safety. When considering the complexity of a compound, the compounding supervisor may want to consider the following. Does the number of steps or complexity of calculations require uninterrupted workflow? More steps means more opportunity for error. Think of making a Prevacid suspension versus a Hyderm Clotrimazole 50-50 mix. Can the compound be safely made in the main dispensary, or does it require a separate room? Can the compound be made at any time of day, or should it be at a time with more staff on duty so there are less distractions and the compounder can focus on their task? Another thing to consider is how many ingredients are required. More ingredients means more chance to choose the incorrect product. Also, how about how much space is needed to prepare the compound safely? Is the compounding space directly next to another pharmacy station? Do employees who are not compounding require PPE to protect themselves? If specialized equipment is required, you may need to refer the patient and help them obtain their compound from a compounding pharmacy. This is not an exhaustive list, and there may be other considerations in different pharmacy settings, but these are some of the things to keep in mind when you're completing the complexity portion of the evaluation of the compounding environment. Worker protection is also an important factor to consider when compounding, but the need for worker protection to be in place really has nothing to do with the compounding standards and therefore is not addressed within them. This is an occupational health and safety requirement in Nova Scotia, and employers are responsible for this under the occupational health and safety legislation, irrespective of the college's compounding standards. If the compounding supervisor has concerns about their workplace, they should be directed to and addressed by their employer. When considering risks associated with compounding and the safety of pharmacy staff, the compounding supervisor may need to implement risk mitigation strategies. All drugs have the potential to cause harm, and the risk of compounding will change depending on several factors. First, we need to consider the ingredients. Are any of the drugs being used considered hazardous? In Canada, drugs are regulated by the Food and Drug Act, not the Hazardous Products Act. Even though drugs are not classified as hazardous products under the Hazardous Products Act, they can still pose a risk to safety. The Occupational Health and Safety Act and regulations require workers to be educated about the risks in the workplace and how to protect themselves. So although this is outside of the scope of the standards of practice, the compounding supervisor needs to take this into consideration. A valuable reference for the compounding supervisor is to review the NIOSH list of hazardous drugs in healthcare settings, developed by the National Institute for Occupational Safety and Health. For the purpose of the NSCP standards of practice, hazardous drugs are those that appear on this list. The compounding supervisor may also consider reviewing safety data sheets or product monographs to determine potential hazards. Another factor to consider is the formulation of the drug or the required manipulation of the drug. Powder ingredients carry more risk than cream or liquid formulations due to the inhalation risk. For the same reason, pouring a liquid carries less risk than pulverizing tablets. You may also want to take into account the quantity being prepared. Making small, infrequent quantities carries less risk than compounding large, frequent quantities. Within the considerations for the evaluation of the compounding practice environment document, there is a diagram to help walk pharmacy practitioners through the evaluation process. When considering complexity, remember that answering yes to any of the listed questions does not prohibit you from compounding the product. It just suggests that you may need to consider if additional strategies are needed to ensure compounding is done in a safe and effective manner. This can be a daunting task, but remember, the standards shouldn't stop you from making any compounds you are already making. They should allow you to continue making them in a way that protects the public in addition to protecting your pharmacy employees. Let's walk through an example of considering the complexity of a compound. I'm going to use a very basic compound that we all make regularly, hydrocortisone 1% in clotrimazole cream. Remember that answers could vary depending on the compounding supervisor or pharmacy, and this is the assessment that I myself would do as a pharmacist. The first question I would ask myself is uninterrupted workflow necessary to complete the required calculations? In my opinion, the answer for this compound would be no. Only basic calculations are required. Next is, do the number of steps involved require uninterrupted workflow? I think most pharmacy practitioners would agree that this compound is made with only a few simple steps, so the answer here would also be no. Next is, does the complexity require a degree of uninterrupted workflow that is not attainable in the dispensary environment? Again, it's a very simple compound that I feel can be made in the main dispensary. Is there a need for specialized equipment? Some may think a hood is necessary to compound this if they reviewed the safety data sheet for hydrocortisone. The need for this will be evaluated more in the next few slides. And lastly, does the space necessary to prepare the compound exceed that available in the dispensary? Again, I think the answer to this question would be a no for all Nova Scotia pharmacies. For the purpose of this module, in terms of employee safety, we will focus on determining the toxicity of the drug and mitigation strategies for compounding hydrocortisone in clotrimazole cream. Neither hydrocortisone nor clotrimazole is found on the NIOSH list, so they are not considered hazardous drugs in Nova Scotia. This does not mean that there are no risks or hazards associated with them. The compounding supervisor may wish to review the safety data sheets for the ingredients. Section 2 of the safety data sheets is particularly useful and reviews the specific hazards associated with the drug. Not all products used for compounding will have an available safety data sheet, and that's okay. In this case, you can review other drug information sources such as product monographs. It would also be reasonable to review the safety data sheet for an active pharmaceutical ingredient in powder form if you are required to crush a tablet, since there would be no safety data sheet available for the tablet itself. When reviewing Section 2 of the safety data sheet for hydrocortisone powder, it is easy to identify potential hazards and think of ways that we can minimize these risks. We also need to keep in mind that we are a community pharmacy and not a manufacturing facility. The safety data sheet is the same regardless of the environment, so we really need to use professional judgment when considering what protections we realistically need with the quantities we are handling. The hazards identified on the safety data sheet for hydrocortisone include eye irritation, so we can specify in our master formulation record to wear goggles or safety glasses to mitigate this risk. There is also a respiratory risk. Well, we can wear a mask. To avoid skin allergy or skin sensitization, we can wear gloves and protective clothing, such as a lab coat that is designated solely for compounding. There is also increased risk with repeated exposure, which would likely not be a concern in the community pharmacy setting due to the quantities used and the frequency with which they are used to compound. Lastly, there is a reproductive risk listed, but we also need to consider here the quantities we are being exposed to when compounding. I don't think many of us would think twice about dispensing a hydrocortisone 1% cream to someone who is pregnant. After reviewing this information, it is my opinion that with proper mitigation strategies, it is reasonable to expect that all pharmacies in Nova Scotia can continue to compound hydrocortisone 1% in clotrimazole cream. Although there is no standard template to document that the evaluation of the compounding environment was completed, the standards do state that compounded non-sterile preparations are prepared in accordance with a master formulation record, or MFR, that includes supporting rationale. I would consider the evaluation to be supporting rationale and would ensure I kept documentation of my assessment and decision within my MFR. Now let's take a look at two other prescriptions that may not be as straightforward as hydrocortisone in clotrimazole cream. The first prescription is for estradiol 0.01% vaginal cream, which is prepared by crushing estrase tablets and mixing the powder into a cream. The pharmacy prepares approximately 30 grams every 3 months. The second prescription is for progesterone 200 milligram vaginal suppositories, which are compounded using progesterone micronized powder added to a suppository base and prepared in a suppository mold. The pharmacy compounds approximately 25 prescriptions for 90 suppositories each on a weekly basis, which equals 2,250 suppositories per week. In this example, both hormones would be included in Table 2 of the NIOSH list. So right away, we know that they are considered a hazardous drug in the healthcare setting. But what do the safety data sheets say? The safety data sheets are actually pretty similar to the one we reviewed for hydrocortisone, but they have an emphasis on the potential effects on reproduction and their carcinogenic potential. We all know that hormones have been associated with development of some cancers, and we've all been taught that hormones are dangerous to give in pregnancy. So, does this mean we can't compound them unless we have a hood? We need to consider how much hormone a compounder is exposed to in each of the examples. In the first example, a compounder would be exposed to the estradiol through crushing 3 1 milligram tablets every 3 months for a total potential exposure of 3 milligrams in 3 months. In the second example, a compounder would be exposed to 450 grams of progesterone powder each week. Those are 2 very different numbers. Is it reasonable to think that we can mitigate exposure risk and prepare both of these compounds in a regular pharmacy environment? So let's think about how we can mitigate risk. Given the quantities used in the estradiol example, it is likely reasonable that we can mitigate the risks found in the safety data sheet by implementing strategies that control the area and timing of the compounding, the use of appropriate PPE, and perhaps through personnel controls. When we consider the progesterone example, we are exposed to much larger quantities of hormone. So I do think it is reasonable in this situation that we put some extra measures in place to protect ourselves. At a minimum, there should be a hood, preferably in a separate room, to allow for the complexity, but also protect other members of the pharmacy staff, as well as the public, who may be present in or around the pharmacy at the time of compounding. In addition, we should always use appropriate PPE, such as a mask, gloves, and lab coat. We can also implement personnel controls. For example, a pregnant person should never compound with hormones. But we always need to use common sense. When we consider hormones, yes, they have the potential to be carcinogenic. But we also need to remember that billions of women take birth control pills every single day. So if you are exposed to 3 milligrams of estradiol every 3 months, what is the actual risk? It really comes down to reviewing the information available, using common sense, and taking reasonable steps to mitigate risk. This ends Module 4. You should now be able to evaluate your own compounding practice environment, assess complexity and toxicity of compounds, and describe risk mitigation strategies. I hope after viewing this module, you have a better understanding of the compounds you make day to day and how you can make small changes to your processes to make the compounding environment safe for both your staff and the public.